Hi, this is Dan Hanson, and this is Dr. Mona Board, and we're here to talk to you about what we're doing at the myofunctional space at the Health Lodge in Byron Bay. And if you're a parent of a child, ages anything between around 2 and 10, that's kind of the main age that we will be looking at working with. And today, I'm just going to do a bit of a presentation for you in relation to all of this stuff. So, yeah, we're going to go into what causes crooked teeth and jaws, and also 3 big reasons, aside from just making the teeth a bit straighter and the jaws a bit straighter. 3 big reasons why it's useful to consider correcting the causes as early as possible, and they're listed there. Basically, improving sleep, which ties in directly with behavior and the ability to do well in school, and also maybe surprisingly enough, bullying. And there's a lot of research on the position of the teeth and how the face looks and so on. That's one of the main reasons why kids get bullied in school. So this is just an example to kind of start with about, you might notice the image on the left there, the lower teeth and the lower jaw is sort of positioned back relative to the top teeth. And if you look at the picture of the boy at the top, his mouth's always open at rest. He's basically mouth breathing, which means the tongue drops down low and the top jaw doesn't get developed properly, because the tongue normally drives the growth of the jaw. And in this particular case, we used a number of different exercises to help change the way the muscles work, as well as some appliances. One of them is shown there, the MyoBrace, which they wear for an hour or 2 each day while they're awake, and also they sleep in it at night, and eventually it stays in at night. And in this particular case, between those 2 images, or the images on the left and the right, it's a total of about 6 months. Often it takes a little bit longer than that. This is a really quick case, but it's just to show you what can happen when we change the muscle function. You see on the right, he's no longer mouth breathing, that means his tongue is more likely to be trained into the roof of his mouth, and he's swallowing better. And so just to go into these reasons why we like to treat early, one of them is bullying, as I mentioned before. So this kind of facial appearance, which some people might sometimes describe as buck teeth, or long face, or biting in an unusual way. These are big reasons why research shows that kids get bullied in school. So that's one reason. There's lots of research papers in relation to that. And you can see in this particular case here, there's also gaps between the teeth and things like that. But we use, again, exercises and also what's called myofunctional appliances. This is another MyoBrace to help to bring those jaws forward and to help to change the muscle function. I'm wondering, Mona, can you maybe describe a little bit about the way that the muscles function, and how that affects the jaws, the growth of the jaws?
Yeah, thank you, Dan. So in a normal swallow, the tip of the tongue goes to the roof of the mouth, just behind the front teeth, and it swallows upwards in a wave-like motion. And this helps to grow the upper jaw to the shape and size of the tongue, and that helps to accommodate the teeth when they come out, the adult teeth. If the swallow is a dysfunctional swallow, we can go into the reasons why that might happen in a moment. If there's a dysfunctional swallow, then the tongue will have a low position and it will push forwards. And in order to help the swallow, the lower lip will push backwards. This lower lip pushing backwards pushes the jaw backwards. And because the tongue has a low position, it's not up there shaping the roof of the mouth. So the palate stays quite narrow. It doesn't sort of grow out into where it should grow.
Yeah. So basically, the muscles kind of act like a sculptor for the growing jaws, and we work on changing how they function so that we can get better growing jaws. And there's another research paper here. The conclusion was significant relationships exist between bullying and certain occlusal traits, which means the way the teeth meet, and self-esteem and oral health related quality of life. So yeah, there's lots of reasons beyond just straightening the teeth as to why we do what we do. And in fact, straightening the teeth is the last thing that really we often think about, right? It's like we think more about the function. That's why we're really privileged to be working here at the Health Lodge, which is an integrative practice. So another reason is behavior, and basically poor sleep relates heavily to poor behavior, and what's described as hyperactivity or conduct or emotional difficulties. So in particular, SDB on the slide here means sleep disordered breathing, and when kids have got sleep disordered breathing, they're not getting good REM sleep. And REM's actually required for short-term memory. So if you want your kids to do well in school, they've got to be sleeping properly. That's just a fact of how the body works. And so sleep disordered breathing is also highly related to this muscle function. And so this paper here is talking about what they're calling myofascial re-education, and why that's important. So what that means is the muscles working properly, re-educating the muscles to work properly, which is what we do here, and how often when things like tonsils and adenoids are removed, if the sleep apnea doesn't go away, often a missing link in that treatment is this orofacial myofunctional therapy, which is, as Mona was saying before, where we're using exercises and appliances to help with that. And this paper, along with many others, is saying that sleep apnea in children is very related to how the face grows. And with what Mona was describing about how the tongue needs to sit in the roof of the mouth to grow the top jaw, it's exactly what we're talking about. So we want the jaw to grow properly so that the airway and all of the bits around the jaw are able to function properly. So it's definitely not just related to teeth. And this is another paper just describing the exact same thing, linking snoring and mouth breathing and apnea on facial morphology, which means the shape of the face. So things like long face, mandible or lower jaw being back, those things are predictive of sleep disordered breathing. And you can't really work on that so easily once you've left the child too late. What would you say is the kind of age that what about the age of most of our patients at the moment?
At the moment, I think the youngest we have is 4.
Yeah.
And the oldest about 11. Is that right?
Yeah. So, basically while the teeth are coming through is when we're wanting to work on them, because that's when the jaw bones are growing as well. And Mona's a mom of several kids and kind of going through the treatment yourself. And
yes,
yeah, it's important thing to do.
It is. It's an important thing to do while they're growing. They're in that golden moment where we can actually change the course of their growth.
Yeah, exactly.
It's great.
Yeah. This paper here is speaking about how a tongue tie, or in this case, they're describing it as a short lingual frenulum, which is the little stringy thing underneath the tongue, how that's related to sleep apnea. And basically, it's the same things as what we've already talked about. If the tongue can't lift up properly and getting into the palate to grow the palate, then obviously we're going to end up with a more narrow, underdeveloped top jaw, and that's a factor in relating to sleep apnea. If there's no space for the tongue, it's likely to fall back and block the airway, is the kind of basic kind of take-home message. And yeah, I don't really want to speak to this sort of thing in toddlers.
Yeah. So this child has their teeth pretty much biting together, so you can see there's a gap between the upper and lower teeth. This is due to incorrect muscle function, and probably the use of either a dummy or a bottle or some thumb sucking or a combination of those. So the tongue is swallowing forwards and it's going into the gap, and then the lower lip would be pushing backwards on the lower jaw. So this patient, this was your patient, or it was a colleague's patient?
Yeah.
And this patient wore an appliance for a few months, maybe 5 months. Is that right?
Yeah, there's the appliance.
That's a Myomunchie. That's worn a couple of times a day for 5 to 20 minutes. It's training the muscles and the jaws to chew. It's posturing the lower jaw forward, which has been pushed back by those lower lip muscles. And it's stopping the outer lip muscles and the cheek muscles from pushing the teeth inwards and making everything smaller.
Yeah, so basically, if you imagine if you were to put one of those things in your mouth, if your tongue is currently going between the gap between those teeth and you're wearing one of those things, your tongue will hit the appliance and be sort of sent up into the palate, like the way Mona was describing earlier. The tongue needs to kind of move in a wave-like motion. So while kids are wearing these things, it's just sort of training those muscles to work properly. And once you stop something going between that gap where those teeth are, the teeth and jaws will naturally start to grow in a more favorable way. And you see in here, this is around about a 5-month progress shot. And yeah, that's again doing some basic myofunctional therapy. So some simple exercises for the tongue to train it up. and also using that Myofunctional there.
Yeah. How old was that patient?
I think they were 2 or 3.
2 or 3.
Yeah, so pretty young.
Change. Yeah, and it's good to start at that age, isn't it? So that this doesn't carry forwards more and more into their growth. Kind of get that growth on the right path earlier rather than later.
Yeah, most of the jaw growth's over by age 6, so we want to be doing as much as we can before that. And also things we find that things move more quickly when the kids are younger. So there's lots of different things that we use. These are just some of them. There's the munchie, which we've already shown. There's the Myo brace, which we showed earlier, which works in a very similar way, train the muscles. Sometimes we have to expand the jaws physically if we're a bit too late, or if the jaw's very narrow. So we use something called a BioBlock for that. Typically takes about 3 or 4 months when wearing the BioBlock. But before and after that, we'll be training the muscles, and occasionally we'll use various other appliances as well. But usually it's the BioBlock or the Myofunctional or the Myo brace. And yeah, this is an example of an exercise. So there's a whole bunch of videos that myself and another colleague, Dr. Donny, put together to show these muscle exercises. This is an example of myofunctional therapy. So perhaps we'll just show the video and you can see how the exercise works. So typically the kids are doing these exercises for anything between about 5 and 10 minutes a day, sometimes slightly less. And there's over 100 exercises. There's lots of them. This is just a very simple one called TikTok. And it's basically strengthening the tongue's ability to get into the roof of the mouth. So this girl is sort of making that clicking noise by lifting the tongue up into the palate and desuctioning it. So we're doing lots of exercises to help change the way the muscles function. So yeah, if you're interested in coming in and letting us have a little look and see if we can help with any of the growth and development of your children, then we're at the Health Lodge in Byron Bay. And yeah, you would call the receptionist up and ask to see either Dr. Mona or myself or both of us. Yeah, we would do a consultation, take about an hour or so, and we'd be able to give you all of your options and help you out. Is there anything to add to that?
No, I think you've got it covered there.
Okay.
Yeah.
Cool. So hopefully we'll see you in Byron. Yeah, get in touch if you have any questions. Our receptionist can answer them for you. Thank you.